health professional. So today we have a training on how we can diagnose and prevent urinary tract infection under a Spectra project. So in this session we will use PowerPoint presentation, case study, group activities and role play. So before getting into the main topic, I would like to emphasize on journal instructions that we all should follow while we are representing Dr. Reddy company to the different stakeholders. So as we all are belong to public health sector or public health professionals like hospitals, so therefore we must maintain the professionalism with all the stakeholders. So we all should be on time, and once you reach on the facility, your duty is to take a round so that you can be familiar with the hospital. So afterwards, if you get a chance to connect with the representative, please connect with the representative of the hospital and ask about the venue where we are going to conduct the training, and how many participants are expected, and what is the qualification of the participants, because it will give you a glimpse whether your participants are belongs to GNM category, BSc, MSc or PhD. So you have to customize your knowledge and content as well according to their experiences and according to their qualifications. So then as I said, we will use different audio visual aids. So once you get chance to meet with the representative, ask him or her to take a 10 copies of printout of the urinary system of the human body, because it will use in further activity. If I'll show in the slide, my cursor is showing, this is the picture that you have to show to the representative of the hospital, or even you can take the help from the Reddy Foundation representative, whosoever is working in the regional level as well as in the field level. So you can give this picture in the Word file to them, and they have to take a 10 copies of 10 copies of printout. Moving ahead, then explain the participant what we are going to discuss in this session. We will discuss about anatomy and the physiology of the urinary system, and most common problem of the urinary system, and what is the causes of the urinary system, and what are the signs that help us to diagnose the case, and accordingly you have to give the interventions and the treatment to the patient. And in the last, we will also emphasize on antibiotic resistance. So after this slide, these are the table of the content that you have to show to them, and just give a glimpse, like these are the objective of the sessions. And then you have to, before getting into the further slide, just divide the participants into the different groups. So suppose there is 10 participants, so you have to divide the number in 3 4, like it's just totally up to you. You can divide one group into participants or 3 participants, is totally up to the number of the participants you will get there. So each group should consist of around 4 3 5, like that. And then distribute one picture of the urinary system to each group and ask them to label the major part of the urinary system. I'll show you in the further slide. Like the picture is this that you have already given to the participants, and ask them to label it, especially the major organs or major part of the urinary system, and give them about 3 or 4 minutes to speak about it. After the time is over, discuss the anatomy and the urinary system of the participants. Ensure that everyone should understand the key structure of the urinary system. If I'll show you in the slide, so these are the kidney. See, these are the kidney that they must mention over there. These are the ureter. They must mention in their in their sheet. If they are not mentioning, it's okay. You have to emphasize later on. Then these are the bladder, and this is the urethra. These are the major key structure of the urinary system that we have to discuss with the participants. So once you are completed with the anatomy, we have to go with the physiology of the urinary system. So under the physiology, we have to discuss about the basic function of the urinary system. Suppose what is the function of the kidney, so you can take the help from the participant. Okay, as per your understanding, what is the work of the kidney? So if they are not able to speak, it's okay, you can move to the next group. Or if still people are not engaged or people are not able to speak, because initially participants have an introvert nature, it's okay, it's fine, but your duty is to make them awake and make them engage. So how you will do it? Ask them what is the function of the kidney. Okay, if they are not telling about it, you have to explain it. Kidney has maintained the hemostasis in our body. In simple language, you can also say that it's remove our wastage from our body, and meanwhile it also helps to maintain the it's also balance the hemostasis in our entire body system. Again, you can ask about the function of the ureter. What is the function of the ureter? So function of the ureter is there to carry the urine. That's simple as you can. You have to emphasize, you are not here to complex the things, because some participants could be GNM as well. So for GNM, the theory part is quite simpler as compared to the degree, that is a BSc, right? So make it very simple as you can. Then the bladder function, ask about what is the function of the bladder carry the urine, and the urethra help us to excrete the urine from our body. So for your reference, if you see in the bottom, we have a footnotes. Just go to the check the footnotes and you will get an idea what you have to speak with the participants. So after discussing the anatomy and the physiology, we have the next slide on purpose and learning objective of this session. So use it only for your purpose. Right now I will show you after this session. So we don't have it. So as of now, I'm not going to show those two slides. I'll show you at the end of this session. That is only for you, only for the instructor, not for the participants, where we have only mentioned what is the objective of this session and how you are going to proceed with that. Now, afterwards, after explaining the urinary system anatomy and the physiology, the trainer should engage the participant by asking them to share, and based on their own experiences, what is the common problem and condition they have observed related to the urinary system. Because our main problem is urinary tract infection. So anyway, you have to emphasize, or you have to came out with this problem only, so that this will helps the participants to connect with the theory and with their practical knowledge as well. So as a facilitator, the trainer should gently guide the discussion so that it naturally leads to the main topic, that is your urinary tract infection. So once the participants start mentioning this is urinary tract infection, the most common problem that we commonly seen in the hospital, that is UTI, the trainer should ask, okay, as per your understanding, what is urinary tract infection? Take one or two responses from the group. And after acknowledging their inputs, the trainer should explain the definition of the urinary tract infection. So, the trainer, it means you all will explain urinary tract infection is an infection that occur in any part of the urinary system like kidney, ureter, bladder, and urethra. Moving ahead, you also emphasize that the urinary system has been divided into two major parts, the upper UTI and the lower UTI. In upper UTI, which includes kidney and ureter, and lower UTI, it's include urethra and bladder. Why I am differentiating it? Because the management and the sign and symptoms are different for upper UTI and the lower UTI. So next, we will proceed towards another activity. So now again, as an instructor, you have to divide the participants into two groups and ask to draw the pathway of infection as per their understanding, how the infection is going to be spread to the different part of the urinary system. After a few minutes, like you have to give another 2 or 3 minutes only, because we have a limited time to explain to take this entire session. So give 2 or 3 minutes to each to every person. So one group should, once the time will over, so one group should present their drawing to the class, like you can call to the participants or one group at the stage and ask, please present whatever you have drawn it. And the trainer should use this opportunity to correct and highlight the actual entry point. I'll show you what is the actual entry point of the infection. If you see at the bottom there is a skin, like bacteria can spread from skin, guts, and it can contaminate the urethra, and then urethra will spread the infection to the bladder, and then bladder, it can leads to ureter, and if the complication is so serious and if infection is getting spread to the systemic infection, then it can affect our kidney as well. So if you can appreciate this picture, it is already mentioned, it's already showing the infection with the color of red, the dark red it is showing. I request to the participants, please go on the mute. Okay, so once you will complete with the pathway of the urinary tract infection, then the trainer can smoothly transition to the next part of the session by saying, even though UTIs are very common, many people still believe in several myths and misconception about them. So these myths often affects many patients, and that also affects the treatment, so which can delay the recovery and even worsen the condition of the infection. So in the next slide we will explore some common myths related to the UTI and find out what facts and the fiction that we can see that. This will also help us to guide our patient better, and patient will get a good treatment in the hospital. So to make this session interactive, the trainer should shuffle the group members once again. So you can shuffle, you can mingle it. If you feel that yes, I don't require to mingle it, you can keep the same group as well. It's totally up to the instructor. If you feel that these group is up to mark, you can keep in a one or two activity. And after two activity, because as of now we have completed two activities. One, during the anatomy time we have divided the participants. Second, we have divided the participants for pathway of the urinary tract infection. Now again you have to divide the participants for the third activity, that is related to the myths and facts. So here is your responsibility or your experience. If you want it, you can keep the same group. If you want to shuffle, you can shuffle it. It's totally up to you. The only objective is keep the group so that the session would be the interactive session. So let's we see our first myths. So these are some common myths that falls under the UTI. So you can do one thing here. You can ask the one group, take another 2 or 3 minutes and write down, is it right or is it true or false? Like suppose the first myth says only women get UTI. Ask the participants in their respective paper or notebook if they have, or even the paper that we have given, at the back of the paper they can write down. Don't write entire content, they can write it 1 2 3 4 5, and on the contrary they can write it, okay, true false true false true false, like that. So that after 3 or 4 minutes has been finished, then we can discuss with those myths. So now, as the trainer, 3 minutes has been completed. Now, as a trainer, then your duty is to explain each myth clearly to them. So, first myth is that only women get UTI. Is it true? Do you think that only women can get the UTI? In reality, women are more prone. So, we have a footnotes, you can further check it. So in the another slides all the content has been already written here. So as it is written, only women can get the UTI infection. So you can ask to the participant, what do you think? Only, is it true or false? Because it was a group activity. So then ask, what do you have written? It's true or false? If somebody says yes, it's true, or somebody says yes, it's false. So smoothly, if participants are wrong, you don't directly say this is wrong. No, smoothly you have to transit. Yes, you are, some extent you are right, but there is another another fact. Women are get UTI, they can get UTI because their anatomy is different than the men, but it doesn't means that men will not get the UTIs. Or why the women are more prone to have UTIs? Because the urethra size is smaller than the male one. This is the main reason. It doesn't means that women is the only person, those who can get the UTIs. Clear with that? Now we have a second myth. So second myth is the UTIs always show symptoms. Again, you can ask to the participant, do you think only and only UTIs shows the symptoms? Is there any condition where the UTIs are asymptomatic as well? So you can take the one or two answers from the participants. So then if the participant, again the principle is same, don't jump into this, jump into like, no, it's not true or it's not false. So you have to say, yes, why UTI will always, why or UTIs is not always symptomatic. There are some UTIs that is asymptomatic as well. So especially in catheterized patients, especially is old citizens, so they are asymptomatics that you have to correct them. The third myth is that all UTIs required antibiotic for treatment. Do you think all UTIs are required? What was the answer you have written in your paper? Ask. If they says yes, all the UTIs required antibiotic, now you have to emphasize that no, all the UTIs are not required antibiotic. If you will give antibiotic unnecessarily, it can lead to antibiotic resistance as well. You must seen in your experience, right? So we will discuss about it in our later on slides, but here only focus that ki no, we require antibiotic in certain conditions, but not always. The fourth myth is the UTI are sexual transmitted disease. Tell me, as per your understandings, the UTIs are sexual transmitted disease. So this is incorrect. Although sexual activities can increase the risk, but it it's not true that UTI is considered as a sexual transmitted disease. No. The next myth is drinking cranberry juice prevents UTI entirely. Do you think the cranberry juice? Have you heard about cranberry juice? Firstly, you have to ask to them because some of the participants are not aware about the cranberry juice as well. So just ask. Have you heard about cranberry juice? If you will drink, then it prevent the UTI completely. So then you have to rectify no. Cranberry juice may slightly decrease the chances of UTI, but it's not guarantee it will prevent completely. So this is the way you have to handle your audience because some audience will be seniors as well than us as because some instructors are young as well, right? So just politely you have to land to the correct answer. The next myths and fact is that poor hygiene is the main cause of UTI. Do you think that poor hygiene is the main cause? See, the poor hygiene is one of the factor. This is the last myth, okay? So it is the poor hygiene is the myth. Like the people who are poor hygienic that only have the UTI. No, it can exceed the chances of the UTI, but this is not only the one factor that can exceed or that can lend you to the UTI. So these were some myths and facts that we have to emphasize on them. The trainer should emphasize each myth are common both in community as well as healthcare profession. It doesn't mean these myths are only and only have by the common people or ordinary people. No, this is also some people, some nurses, some doctors, they also have some myths regarding it. So you have to emphasize it very, very correctly. These slides are very important because firstly you have to brainwash their myths, brainwash their myths that they have occupied. Like some people are already preoccupied with this myth, so that you have to delete it from their mind first. So that's why we have to do activity in this exercise or in these slides, and we have to give at least 5 to 10 minutes to explain all the myths, all the facts about it. I hope everyone is clear with that, right? Now the trainer should transit to the next topic by saying that now that we have clarified the myths, let's discuss the actual cause of the UTI. The next few slides will be more theoretical, and but we will make it engaging through a short activities because next 4 slides, I meant to say that, will be bit theoretical. Moving ahead. So here, before showing this slide, you have to ask them again. You have to divide the participants into the groups. The same, you can keep the same group as well, and ask them, okay, as per your understanding, what could be the common cause that falls under UTI? Why the people is having UTI? So that you have to ask to the participants. So if you feel that now you have already given so much time for the myths and facts, so you can proceed with the common, like you can explain the causes by your own and ask 2 or 3 answers from the audience. If you feel that you have a plenty of time, then you have to divide the participants and proceed with the causes, right? So here I'm taking I'm taking so much time for this session, so I am going to just take one or two answers from my audience. Like, what do you think, what is the common causes of the UTI? So some person could give the answer like UTI can be spread by unhygienic, that is the one of the myth that we have already discussed, and females are prone, or might be bacteria, E. coli is the more common, or sexual activity can increase the chances of the UTI. That could be the answer you can get from the audience. So then you have to discuss about all the causes that falls under UTI, that caused UTI. Let's we see one by one. I will explain it each causes with the explanation. If you want it, we have a notes, footnotes, you can just refer those notes. If you want to add something, you can add. If you want it, this part is not necessary, you can customize like 5-10%, you can customize it. But as per but I'm trying to keep it very simple so that everybody should be on same page. So let's we start with the first causes. Have you seen this bacteria? My cursor, are you able to see that? This one. So I'll talk about the bacteria first. The most common bacteria that cause UTI is E. coli. You can ask to participants as well. What is the most common bacteria that's cause the UTI? If they say E. coli, then fair enough. Then appreciate the participants. If they are not saying this is not, if they are taking another bacteria's name, then you can ask them, okay, E. coli is the most common one, because it can easily enter the urinary tract through the urethra and cause the infection. If you have seen the previous slide, I'll show you back. See, this is the infection pathway, right? So skin, the E. coli can easily enter to the urethra, or I have written here gut as well. So E. coli is mainly present in our gut as well. So it can easily enter into our urethra, right? So then it's spread to bladder, then ureter, then kidney. So make sure about it. E. coli is most common cause of the UTI. Moving ahead, we have another cause, that is a female anatomy. We have already discussed about it previously when we were discussing about the myths. Women are prone to UTI because the urethra is shorter and located close to the anus, and it make making it easier for the bacteria to enter into the bladder. That is the reason. Females has only 3 or 4 centimeter size of urethra. Male has a 25 centimeter of urethra. So that is the difference. It can easily invade, right? Moving ahead to the third cause, that is a sexual activity. Are you able to see my cursor? This is a sexual activity, is my further cause. So sexual intercourse can introduce bacteria into the urethra, especially if hygiene is poor before or after the act. That could be the reason. That can also cause the UTI. And next we have a diabetes. Are you able to see my cursor? This one, yeah. This one is the fourth cause, the diabetes. So diabetes means, you must heard about 3 P's, right? The polyuria, right? So in that case, if patient is having high blood sugar, it weaken the immune system. If it will weaken the immune system, it provide a favorable environment for bacteria to grow and increase UTI risk. This is why the diabetic patients are more prone to get UTIs. Clear? Then we have a poor hygiene. So as I have already spoken about it, it's the one of the factor that cause the UTI. So improper wiping, like those person who are wiping from back to forth. I will discuss about it more when we will talk about the prevention. As of now, just understand it. If people are wiping from back to forth, so the chances of UTI can be increased. If people is not having not having hydration, or not having water properly, that also it will increase the chances of UTI. And infrequent washing, that also increase the chances of UTI. And the last, if you are using unclean toilet is also responsible for entering the bacteria into our urinary tract system. Now we have another cause, that is a urinary retention. So when urine stay in the bladder for long time, especially while you are driving or while you are traveling to one place to the another place, and you don't have a clean toilet there, and if you are holding the urine for long period, it can also increase the chance of breeding around the bacteria. So that is the only reason the retention of the urine also increase the chances of UTI. Now we have a menopause. So menopause is related to female, right? So menopause, what does it mean by the menopause? It means that now the female is not able to reproduce. Now the female doesn't have menses. That is called as a menopause. That usually occur after 45. Means the women are more prone to get UTI, because one, she is going towards old citizen stage, right? And the second thing, while the woman is cross the menopause, so that time there we have some changes in our body, especially the estrogen level gets decreased in our body. So that leads to changes in the vaginal flora, and that also thinning the tissue of the vagina, which increase the chances of infection, because if the lining is thin, the bacteria can easily invade. I hope you are clear with that. Now we have another cause, that is kidney stone. So it's very simple. If there is a blockage, then if we have a blockage, the urine will be hold, and if the urine will be stasis, the bacteria will be growth, and which can leads to infection, right? Poor hygiene, it has been written in two time. Okay, you can explain it only once, fine. Moving ahead, we have a catheter. Especially here, I would like to emphasize that any tubing, whatever tubing you are using for the patient, whatever tubing in your hospital, that increase the chances of the infection, especially your catheter. So most of the hospital has the policy to do the catheter care thrice in a day, right? But here, if a patient is coming to you and patient is with catheter, or if you are inserting the catheter to the patient as per patient's condition, so patient is prone for the UTI. You have to take a extra precaution so that he will not get an infection. I hope I'm clear. Now the bacteria, already I have explained it, that sexual activity I have explained with that. So these slide is little bit monotonous, but it's okay. You can concise. I have explained thoroughly. You can customize it like it is required for them, or as per the participants' interest. You can jump into the next slide with just with a one word of the explanation. But I thought like this is a duty for our trainers, so I should explain each things. Next, now I hope everybody is clear with the causes of the UTI. Next, let's move the sign and symptoms of the UTI. To make it interactive, ask the same group of the participants to write down common sign and symptoms that they have observed in the patient. Once they finish, like you have to give 1 or 2 minutes to the participants. Once they finish, ask them to share what sign and symptoms they had usually seen in UTIs. So they will give some answers to you. So once they give some answer to you, you have to emphasize that, as I mentioned in the previous slides, we have divided the UTI into two parts, lower UTI and upper UTI. Again, you have to classify the signs and symptom also in a two parts that should be related to upper UTI and lower UTI. If I give you an example of the flank pain, are you able to see my cursor? The flank pain usually occur in upper UTI. Now you can diagnose it, right? It means that the infection has been leaded to kidney, because pathway देखा था ना अभी आपने पीछे, how the infection is spreading, the ascending pathway of the infection, right? UTI ka. So if you have seen that in the previous slide, if it reaches to the pain in the flank reason is related to kidney, right? So it means infection is serious. Infection is related to upper UTI, right? Similarly, pain in abdomen pain, it is again related to your upper UTI. If patient is having pain in lower pelvic, it means that patient is having pain in lower UTI, now not in the upper UTI. So that's why you have to ask to the audience, please specify which symptoms denotes which type of infection. Is it related to upper UTI or it is related to the lower UTI? Because the treatment is very as per the as per the patient's condition. So after completing this part, now you have to move toward the common sign and symptoms, or common investigations. So I'll show you the investigation slide now. So you can ask, before getting into the next slide, you can ask, okay, as per your understanding, if patient come to you with the UTI, what are the common investigation you are practicing in your hospital? Some will say, "Oh, we are doing routine culture, we are doing routine microscopic examination. Sometimes we also do CT scan." So then you just collect all the answer, then explain the next slide to the patient, to the participants, right? So as you have seen in this slide, it has already mentioned the dipstick test. Mainly the dipstick step we usually do if the condition related to kidney, and the second thing, if the condition related to pregnancy, that is a very, very common, although we have to do the diptychs test in another conditions as well. But mainly, if mother is coming to you, you have to do the protein test. That is related to the another condition, but it is also falls under the one of the criteria if you want to understand the UTI. Then you can go with urine, microscopic urine examination. Then urine culture, you can do it here. Under the urine culture, you can emphasize that if a patient is having catheter outside the hospital, you must have to take urine culture, otherwise it will falls under in your hospitals. Like, if patient is having UTI, right, you must have some quality indicators in your hospitals that you have to meet if you want to maintain that standard. So if the patient will get COTI, it will falls under in your hospital if you are not doing urine culture and patient is having catheter outside the hospital. Probably patient is having infection outside the hospital as well, right? So you must keep this practice in your hospital. Do the culture as soon as patient arrive and as soon as you get the time. Then if the conditions are very complicated and patient is having recurrent UTI, and then you can go with ultrasound, you can do CT scan, you can do MRI as well. But it's in a complicated cases, don't do it in a routine basis because these are very expensive tests. So we have to understand the financial burden as well of the patient, if especially if you are working in a government sector, if you're taking session for the government. So make sure about these points, right? Even though it's applicable for private as well, but still. Now you can go with the next test, that is the cystoscopy. Cystoscopy, it means that you have to check the bladder condition. That also we have to do if the conditions are complicated and recurrent. And the last, PCR test for rapid detection and resistance gene. These are the least, we are not commonly prefer it. This test we normally do when the patient is having a communicable disease. So as of now, you just stick to these three tests. One is urine analysis, second in microscopic urine examination, and urine culture. These are the three tests that you have to emphasize, because normally in the hospital setups we are doing these tests, right? So now I hope now as a trainer, so we have completed with definition, right? We have completed with causes, we have completed with sign and symptoms and investigation. Now it's time to focus on the most important part of this session, that is the preventive strategies that we have to follow during the hospitalization. Explain that prevention while you are taking this right now. I'm not jumping into the next slide, but here you have to emphasize to the participants. Now, the prevention is the heart of the nursing practices when you are managing the UTI cases, especially to control the hospital acquired infection, right? So, tell the participant that these preventive strategies are divided into two stages. Let's see. These preventive strategies we have divided into two strategies. One, One is during insertion, the strategies are different. During maintenance, the strategies are different. Clear with that? During insertion and during maintenance, the UTI prevention is very, very important that we all have to follow. Ask the participants, what strategies do you currently follow to reduce the chances of infection during catheter insertion? Take 2 or 3 answers from the group. After listening, summarize their responses and emphasize key points such as ensuring correct indication before insertion. I'll show you the next slide. See, during insertion time, these are the certain strategies that you can follow. First strategy is that we have to focus on indication part. Firstly, you have to check whether this patient require catheter or not. Sometimes we also catheterize the patient as per our convenience. Like if somebody is asking you, please give me urinal again and again, and that is a diabetic patient, and you don't want to get up all the time, so you request to your RMO, please sir, write down write for the catheterization. Please make sure that we have to be very, very wise with the patient. So that part you have to emphasize to the audience, emphasize to the participants. Firstly, you have to check the indication for the catheterization. If it's required, then go ahead. If it's not required, please don't catheterize to the patient. Then the another important strategies is check the appropriate size of the catheter. So what does it means? That you can ask to the participant, iska kya matlab hai? Why we require the appropriate size of the catheter? So take one response or two response, because this is, as I said previously, this is the heart of this session, right? These slides are the heart of this session, because you are giving training to the hospital, especially to the nurses, so you have to emphasize these interventions. Clear? So choose right catheter at a appropriate size, because if patient is old citizen, or let's we take an adult example, if patient is adult, like suppose my age is 30, right? So if I'll be your patient, or if I require 14 French catheter, and if you are using 18 French catheter for me, so what will happen? It will expel out. If it will expel out, what will happen then? Then you have to again reinsert the catheterization, you have to again do the catheterization. Tab kya hoga? Then it will increase the chances of infection. As I said previously, you are using any type of catheter, it increase the chances of UTI. I hope you are clear with that. Then the another intervention is that hand hygiene and wear PPV. This is very common, although it is very easy, but this is falls under human behavioral, uh, yeah, human nature, I would say. So here you can emphasize, please, hand hygiene and wearing pp is not for only for patient, it is also protect you. Firstly, you have to protect yourself, then only you can protect to the patient, right? If patient is having infection, it can spread to you as well. So please emphasize on hand hygiene, 5 movements of hand, and PPV. Whatever PPE is required as per the hospital policy, they have to wear it. Then further, you can discuss about non-touch technique. Every nurse has to follow aseptic non-touch technique. You can ask to the participant, okay, what does it mean non-touch technique? So then you can explain to the participant, non-touch technique means that when we have a catheter, there is a two polythenes, right? And you must have a one assistant just next to you while you are inserting the catheter to the patient. So one catheter, the upper polythene, the assistant will open for you, and inside the polythene there is a catheter, and the catheter itself has another polythene, and that polythene in the front at the tip side there is a marking, and that marking part you have to ask to the assistant to pull towards, and once she pull, you are not supposed to touch the tip, and then put the jelly and directly insert the catheter to the patient body. So this is called as a non-touch technique. You didn't even touch the catheter, even your assistant as well, the tip one, that is a major part you are entering into the patient body, that is called as a non-touch technique. You can ask to the participants, as a trainer you can ask to them, if they are not able to explain, then you can explain to them, right? But it is important. Not a single person can do the catheterization. There must be assistant as well, because COTI is very, very important. It's a one of the quality indicator. Now the another strategy is that use trial equipment and the items. We all have catheterization sets with us in our ICUs, right? Or even in the wards as well. If they have, fair enough. If they don't have, then also you can emphasize, because catheterization sets are different, so that you have to take from the CSST department. They have to keep it in their respective places. Or if they are not keeping it, then they ask, please start keeping it. They can take it uh, a homework. They can do it later on then in their respective departments. Then the last strategies falls under during the insertion time is use a closed drainage system. So what is closed drainage system? Again, you have to ask to the participants. क्या समझते हो closed drainage system से? You have to ask. So closed drainage system, it means that while you have insert the catheter, we have a Euro bag. So immediately connect the Euro bag. And even in the Euro bag, there is a point at the bottom that is also secure. If it's open, again, through the floor, the infection will enter in the bag and the bacteria will enter in the bag, and in the ascending way, it went to your back to the patient body, and patient will have the COTI. Clear with that? These are some strategies that we have to follow while we are doing catheter to the catheter to the patient, while we are inserting catheter to the patient. Now we have another strategies that we have to follow during the maintenance time. So this, the insertion might be morning nurse has been inserted the catheter to the patient, right? Now the another nurse come in the next shift. So now there are some interventions that she has to follow because she came in the evening shift, and now the patient is having catheter. Now she has to use different type of strategies so that your patient will not get UTI. Let's see it one by one. Even though you can ask to the participants, okay, if patient is having catheter, now you are in a evening shift nurse or the night nurse, what are the strategies you are using so that your patient will not get infection? You can ask to the audience, right? If they are able to give the answer, fair enough. Otherwise, try to encourage them. Try to encourage. If one person is speaking, try to encourage to other person. Okay, आपने भी अभी तक कितने साल काम किया है और आपको कभी लगा है, क्या क्या स्ट्रेटजीज आप फॉलो करते हो ताकि आपके पेशेंट को यूटीआई ना हो, है ना? सो यू कैन आस्क. So these are some interventions that we have to follow during the maintenance time. Again, first is hand hygiene. That is first. That is very common that everyone has to follow. Especially, I would like to emphasize here. Please ask to our RMO as well. If he or she is also touching the catheter, they also have to follow hand hygiene, because once they become they get into the healthcare professional, they are checking so many patients, and sometimes they forget the importance of hand hygiene as well. It doesn't means that you are the nurses, you are not able to say a single word to the doctors. No, we all are working with doctors, we are not working under doctors, right? So you can also emphasize, yes sir, you have to use hand washing scrub, or you have to do a medical hand washing if you want to touch the catheter of the patient, right? Now the second strategy is, now perform catheter care aseptically. So what does it mean? It means that every nurse or every hospital has a protocol to clean the catheter in every shift. Some hospital has a protocol to clean the catheter once in a day. Both are acceptable. Both are acceptable. Under the CDC guidelines, once in a day catheter care is acceptable. So you can say, if public is saying, if the audience are saying no, we are doing thrice in a day, accept it, accept it. If they are saying we are doing once in a day, yes, accept it. Once in a day, normally, ideally, we have to do once in a day. But if there is an outbreak, then there is a hospital call whether they can keep it every second hourly or every shift. Clear? Now, next strategies. Let's we move to the next strategies. Review necessity of the catheter regularly. Check whether the patient is required catheter or not. Because nowadays we have a surgeries, we have advanced surgery, laparoscopic surgery. We don't require to keep the patient for more than 7 or 8 days. Sometimes some surgery, we discharge the patient in the very next day, like your appendectomy, right? Cholecystectomy. We give the discharge the patient immediately the next day. So check the necessity. Do we require? Do we require to keep the catheter? Check the sensation. Ask the patient. Do you have a sensation? Secure the catheter with the syringe. So check the patient is having sensation or not. If patient is having sensation, remove the catheter immediately. This is very, very important. Don't keep unnecessarily catheter into the patient's body, right? I have already spoken about it. I don't want to repeat it again and again, but it is very important. Clear? Now, maintain unobstructed urine flow. What does it mean? Unobstructed urine flow. It means that gradually or with the interval, nurse has to go and check. Is there any blockage in the catheter? Is there any clot in the catheter? That she has to check. If there is blockage, there is, like, every hourly we have to check the urine output, right? So just check what is the color of the urine. Is there any clot? Just check it. Clear? Now, urine bag that should be below the bladder. Secure the catheter on the thigh without kinking, and maintain a closed drainage system all the time. That also you have to ask to the participant, what does it mean, closed drainage system? So closed drainage system means that, like, if patient is having euro bag, generally what we do, we never empty the we usually not empty the catheter Eurobag. We have a JDAs, we have a housekeeping staff with us, right? So they typically they do it, right? So, but they are not healthcare professionals. They don't have a degrees, so they don't know the importance of, if the patient will have infection, then it will affect not only patient, it will affect us as well, right? So in that case, if they are empty the euro bag, you have to check the euro port, the bottom wala port, that should be secure, that should be closed. If it is not closed, if it's open, then again the patient will get infection. This is very, very important. Here you have to emphasize on this point. If you want to highlight it, you can highlight in your respective slides once you get it. Clear? Now, the empty the bag regularly. Ask कितना बैग भर जाता है, तब हमें empty करना पड़ता है. Ask to the participants. So 3/4, once the bag is filled with 3/4, please empty it. Now we are completed with strategies at the maintenance level as well. So that was a preventive strategies, right? Now we are doing, now the patient is having UTI. Now we have to give treatment. So now there are certain points that you can emphasize it. You can go with the activity, or otherwise, if you feel that right now we don't require it, because our focus is to prevent the UTI. If patient is having UTI, then the strategies are typically different. Majorly the responsibility of the doctors then, right? 60-70% is the responsibility of the doctors then, because they have to give the antibiotics. Then our duty is to give the health education. Clear? So here you can just slide, okay, the patient has to complete the antibiotic. I will discuss about it, why it is important. Hydration is very important. Again, in a coming slide, I will discuss about it. And then pain relief, if needed. Although pain medication, don't take it without doctor prescription. Moving ahead, recheck urine. Is there any recurrent or complicated infection that the person has to inform? So this is a part of your education. Moving in another slide, we will talk about hairstyle, lifestyle. I will talk about it. Special cases, I will talk about it later on. And the follow up, what are the things that we have to check? I will discuss about it in the further slides. Clear, everyone? Okay. So just give me 1 second. I have to have water. Okay. Yeah. So now we will focus on comprehensive patient care overview. What does it mean, comprehensive patient care overview? So the first thing is that, see, our next slides are based on this slide, the comprehensive patient care view. So you have to emphasize all 5 parameters with the participants. Suppose there is a one patient arriving in your hospital. What is the primary responsibility of the nurses? Primary responsibility is that she has to do assessment. So she has to assess the patient. She has to gather all the information from the patient, right? So here you can emphasize one more part. Please, while you are gathering the information from the patient, make sure that you are involving the family members. It is very, very important, because if you are not involving the family member, you will not able to build the trust on patient as well as with the attendant. So please, whatever you are explaining to the patient, explain to the family member as well. And family member should be with the patient, and ask the patient which family member patient wants to keep with him. If it comes to the vote, ICUs, everybody knows that nobody is allowed there, right? So just emphasize this part. During assessment, we can use some tools as well, like IS bar. Have you heard about IS bar? Anyone? IS bar means that you have to identify the patient first. So ID band should be with the patient, as well as call the patient by name. There is a two indicator that a patient must have. Sorry, while it comes to the identification, there must be two identification indicator. First, most reliable, that is your call, ask the patient or call the patient by their name. Second indicator, please check the ID band, check the UHID. These are the some indicator that you can use. Then S stand for what is the situation. Ask, okay, why you came here. Firstly, go with the chief complaint. That is falls under situation, right? Then background, okay, how frequently you are having UTI, okay, when it has been started, okay, do you have any past surgical history, do you have any medical history, okay, do you have any family history, okay, fine. So now then you have to check the vital signs of the patients. Afterwards, is there any recommendation has been given in the patient OPD notes? Just check it once. This is a communication tool. This will help you to gather the important data. There are so many tools. I have a limited time here. I don't want to discuss it entire one, but it is very, very important to use the communication tools, right? This is the one comprehensive patient care strategy. Second strategy is catheter care. A patient comes with you in your hospital with a catheter, so please follow all the aseptic protocols, that the strategies I have discussed in the maintenance, right? Here I have discussed, see, all the maintenance related strategies that you can use it, so that your patient will not get any kind of infection. So yeah, so under the catheter care, you have to minimize, your patient will not spread the primary infection to the secondary. It means the if patient is having minor infection, it should not be lead to the serious infection. It's your responsibility. Now the third thing is which is related to the second part as well, infection prevention. So every hospital has a infection prevention protocols, strategies that they have to follow, like BMW segregation should be proper, hand washing should be proper, 5 movements of hand should be proper. So these are some strategies that they have to follow, clear? And even the bundle of care, that is also in your ICU charts, that they have to follow it. And then the communication and the reporting. So under the communication and the reporting, ensure that while you are giving handover should be proper. And while you are documenting the things, the document should be clear, right? Now the last strategy is the comprehensive patient care is patient and education, health education. You have to give health education to the patient as well as attendant, because most of the time attendant is staying with the patient. Yes or no? You can ask. This is very important. These are the 5 major comprehensive patient care. If you will see next slide, under next slide we have a case study. So before getting into the case studies, firstly you have to emphasize this slide once again. like nursing assessment, catheter care, infection prevention, what are going to do it, communication reporting, and the patient care that you have to do. We have a footnotes as well. So I have already animated it. Go to the footnotes and check it. What does it mean nursing assessment? What does it mean catheter care? I have already explained it, but for your references, I have also written in the footnote so that it will be helpful for you for taking the session. I hope everybody is clear now, right? So now we will jump into the next slide. So before getting into the next slide, now again divide the participant, or you can jumble the participants and ask them to read the case study. I will show you the case study. This is a case study. Ask them to read the case study. So you have already divided the participant. You have already given 2-3 minutes to read them. Once they read the case study, now like you have to take a pause for 3-4 minutes. Now you have to read the case study for them. Once again, the instructor will read the case study for the participant and ask them to use the same framework that they just have show in the previous slide, like this one. The same framework they have to see, they have to use while they are solving this case study. So as an instructor, you have to understand that this case study you also have to emphasize, especially the sign and symptom, because if you will not emphasize the sign and symptoms, they will not able to get the idea, okay, what is a diagnose. If you don't, if the participants are not able to diagnose the case, like it's related to upper UTI, lower UTI, they are not able to manage the case. Clear with that? For you, I'll read one case study. We have a 2 case studies in this session. For you, I will read one case studies for everyone. Clear? Like Mr. Kumar is a 30-year-old man and he is working in steel factory. At the workplace, he used a shared washroom and there was no water supply for since last 2 days, and there was no tissue paper that was also not available. And now he came to the hospital with a certain sign and symptoms, and those sign and symptoms are burning pain while he was passing the urine, and he needs to go to the bathroom very often, and only a little urine comes out with each time. Urine looks cloudy and smelly is very bad, and stomach pain just above the pubic area. So then you can ask the question, okay, what is the diagnosis? Can you guess the provisional diagnosis? Because provisional diagnosis is the responsibility of the nurses. Final diagnosis is the responsibility of the doctor, right? So provisional diagnosis you have to ask to the participants. So again, we have a footnotes in this case study. All the questionnaires I have already written in the bottom line in the footnotes. You can take the same question and ask them. Okay, in this case study, what was the cause? Why Mr. Kumar had UTI? Why Mr. What are the common signs and symptoms the Mr. Kumar had? How you have differentiated that whether it is related to upper UTI and lower UTI? These falls under nursing assessment, right? Then what are the protocols that you will follow? The infection protocol, so that your patient will not get any further infection. All the insertion strategies or maintenance strategies, now you have to use it. Like suppose this is the case of the OPD, now you don't require the catheter care, but you require another uh, infection control protocol, hand hygiene, that should be proper. Okay, this may likewise there are another strategies also that you can ask to the patient. Then the another thing, communication. Under the comprehensive framework, there was the fourth strategy, that was the comprehensive um, communication, right? So for the communication, one nurse has to give a proper handover to the next nurse regarding the Mr. Kumar, so that Mr. Kumar will not spread the case of infection to his another part. Clear with that? It's not like a UTI is only affect the kidney. It can affect to the other part if it's complicated, if it gets serious. Because I have seen so many cases where a person come with a minor illness, minor infection, and landed to death. It is as serious as we have to take. Clear? This is the first case study that you have to ask to the participant to solve it. And here also you can emphasize like that you have already explained the case study. Questionnaire I have already told you, it's written in the footnotes. Now you have given 3-4 minutes to the each group to take and understand the case study. Now here you can involve the participants. Now ask the one group, please come to the front and explain केस स्टडी क्या था, causes क्या थे, sign and symptoms क्या थे, क्या diagnose आपने बनाया. Okay, then ask to the audience, is they right? Is it upper UTI or lower UTI? Although it's the case of the lower UTI, right? Because the pain is a classical sign. See, the stomach pain just above the pubic area, it means that it is related to bladder. If I will write here, patient is having pain in abdomen, upper abdomen, that is related to upper UTI. Clear with that? I hope everyone is clear. Now we'll move to the next case study. Again, keep the same participants and ask the participant to take 2 or 3 minutes and read this case study. Read the case study, and once they complete with 2-3 minutes, again the instructor will read it. Instructor will read and explain every part. Now I'm not going to explain it. Now your responsibility is to read this case study by your own, same as case study 1. More or less the case studies are same in terms of it, both are related to UTIs only. Clear with that? So just emphasize it, and the same protocols you have to follow that you have used in first case study. I have also written here in the footnotes. You can take the references from here. Clear with that? Do you have any question here? You can ask if you have any question, okay? That you can ask to the participant in the same way. Everybody is clear with the case studies, or still they have any doubt on that? You can ask to the patient, you can ask to the participants. Clear? Let's move to the prevention strategies or lifestyle modification strategies. So here you can ask a question like, we are the UTI is so common among patients, among community. What could be the reason why the person is having UTI? You can take 1 or 2 answer, then proceed with the next slide, where it has been written all the journal interventions, comprehensive UTI prevention strategies. I'll show you. These are the comprehensive UTI prevention strategies. So that with the question, you have to start it. How you will start it? Once the complete case study has been completed, you can ask the question, why the people is having UTI very commonly? Or even though we are following all the infection control protocols in our hospitals, why? What are the causes? Then you have to start with the next slides. These are the comprehensive UTI prevention strategies they can use if they want the people will not get UTIs. Clear with that? Okay, so let's we see one by one. The first UTI prevention strategy is hygiene practice, right? This one is the hygiene practice. Then the lifestyle change, your modification, whatever you want, you can say it. Then proper hydration, special consideration for pregnant women and adult patient, and there are additional health factor. These are all written here. I will discuss it one by one. You have to discuss with participants one by one, like under hygiene practice, what are the things that they have to follow? Under lifestyle changes, what are the modification that they have to follow? For the special consideration population, for pregnant women, what are the things that they have to emphasize? Clear? For the hydration, again they have to emphasize what is the role of the hydration, and additional health factor, like some people use smoking is also one of the leading cause that cause the UTI. Clear? Let's we see it one by one. Okay, so now I will not explain entire thing because these all are self-explanatory. But for basics, I would like to say, under essential hygiene practice, emphasize that these are part of health education, and health education doesn't mean that you have to give during the time of discharge. No, you have to start once the patient admit. Whenever you get a chance to connect with the patient, if you get a chance to talk with the patient, start with them. Start the right time. Clear? Now, under the essential hygiene practice, patient has to clean the front to back part after defecation as well as urination. She will also add importance of wearing cotton clothes and also emphasize that after defecation and urination, all the person has to wash their hands with proper time. Please, you all just go through each point and you will get an idea for this. It is a self-explanatory, and only I have request to all the nurses give the education to the patient along with the family member, because family members play a vital role or they support to each other to follow these all practices at their home. Clear? Now we have a next slide, and it is also written about the lifestyle changes that are required to control the UTIs. So even you can ask to the participants to each point and start discussion on this. However, don't put too much pressure on this slide, because these are related to the behavior changes that will not take place in a one day, but you have to go through the major points, right? It's not a one day activity. A nurse can motivate and educate the patient whenever possible. Clear? Okay, so bladder habit. Like, so I'll give you one example. Like, while we are traveling from one place to another place, sometimes we hold our urine because we don't like to use a shared washroom. Ask them, please, whenever you get a chance, please empty the bladder, because if you have see the previous slide in the courses, holding the urine, it will also increase the chances of bacterial infection. Am I right? Right. So please hold it. Please urinate whenever it's possible, as well as hydrate yourself. Hydration is very important. I'll show you why. Every day a person has to drink 8 to 10 glasses of water, because if you are having 8 to 10 glasses of water, your UTI reduction will be 50%. Can you see here? 50% UTI will be decreased. I am not saying, studies are saying it, right? So if you are educating your patient, please emphasize 8 to 10 glasses of water they have to use every day. Clear? Now we have as I said, we have a special consideration for special people, especially for your pregnant woman. So these are also self explanatory, like, because when a mother is pregnant, right, she must have some hormonal changes, anatomical changes also occur, right? And because of that, the mother is not able to completely empty the bladder, and because of that they have increased the chances of UTI. So it's very serious to emphasize this part here. Like, if a pregnant woman is having infection, it is not only affecting the pregnant woman, it is also affecting the neonate, because if a mother is having infection, it propel the neonate, it propel the contraction, and if the contraction will propel, the baby will deliver prematurely. If the baby will deliver prematurely, and you all know that prematurity is the leading cause of the neonatal death. You have to emphasize this line to all the participants. I have written in the notes, footnotes, just take the reference for it. Rest you can give education. Please, you have to hydrate yourself. Please monitor your urine frequently, because you can, so that you can analyze the protein level, right? Because if patient is having high protein level, you all know patient will again, the mother is can might be can diagnose to the mild eclampsia or mild preeclampsia or severe preeclampsia, right? So just emphasize this part. Modify the position, that is also very important. While she is passing the urinate, she can take a footstool. That is also help her to and completely empty the bladder, because she is pregnant. Clear? Okay. Now these are the special consideration for the pregnant woman. Similarly, we have some other consideration for another special person, that is our old citizens, because old citizens are prone for UTI infection, because once the patient's age reaches at the certain level, their sensations get slow. So they are not able to ask to the nurse, please, now, right now, I want to pass the urine, because their senses is not in their control. So this is a nurse responsibility. They have to monitor their hydration if the patient is admitted in the hospital, or if the patient is getting discharged. Again, you have to emphasize these parts to the family member. uh, Patient is important, I understand, but when patients is old, then you have to emphasize, you have to give education to the family member along with the patient. It's very important. Okay, now the scheduling, toileting, and assisting with the hygiene, that is also you can share and you can ask to the participants. Clear with that? Now we have another additional health factor that can also increase the chances of UTI. So if person is having smoking, as I mentioned previously, patient is having smoking, so again the patient is prone for UTI. Please ask them to quit the smoking, and please have the balanced diet. And if the patient is having chronic kidney problem, so ask them to manage those conditions, ask them to have the water, ask them take all the health precaution as much as they can. So these all are part of health education. I hope everybody is clean. So now here is a time, then ask to the participants, please make a plan, care plan for you. Like suppose there is a one, ask to the participants, please assume that there is a case, and now you have to make a plan for a patient so that the patient will not get UTI. So all the things that we have discussed so far, ask the participants, please, you have to write down how much you understood so that we can proceed to the next topic, because now the next topic is completely different to this. Okay, so we so far we have discussed about what is UTI. Firstly, have we discussed about the anatomy and the physiology? Then we spoke about what is UTI, upper UTI, lower UTI. Then we spoke about pathway of the UTI infection. Then we spoke about myths and facts. Then we spoke about causes, sign and symptom, investigation, and the prevention strategies. That was the heart of this entire session. What are the strategies that we have to take during the insertion time, what are the strategies that we have to take during the maintenance time? Clear? Then we also spoke about the comprehensive patient care, like during the comprehensive five main concerning point that we have discussed. And then the lifestyle modification, so far we have discussed about it, and we also did 2 case studies. Clear? Now we have to make a plan. So give another 3-4 minutes to them, to each group, and then ask one group to come and present what are the strategies that you will follow, so that you will, okay, might be you will not get the infection, your family member will not get the infection. You hypothetically, you can give any statement to the participant. Clear? Now, so when they are making the plans, so now ask why UTI prevention matters, why it is very, very important. So then you can discuss about it can reduce the complication. Yes or no? Like patient comes with mild illness, mild UTI, and you have given their proper treatment. It will not exceed to the serious. Yes or no? Right? It will reduce the chances of complication. Then if you are giving the antibiotic, that is a first generation antibiotic you are giving, and uh, patient is dealt with this first generation antibiotic, it will not leads to the second generation, and it will not develop the antibiotic resistance. Here you have to emphasize this topic, antibiotic resistance, because next slide is based on antibiotic resistance only. So now your another topic will start, why antibiotic resistance is, why the person should not have a antibiotic resistance. Clear? These are the some preventive strategies that we have to follow. Moving ahead, ask what is antibiotic resistance. Take 1 or 2 answers from the participants. If they are saying you have to take the answers from the participants. If they are fair enough with the answer, then you have to reiterate. Antibiotic resistance happen when the bacteria no longer responds to the medicine that we have used to kill the bacteria. In the UTI, it is the biggest challenge in our country. not only country, and everywhere. It is a very, very burning, emerging challenge. So we have to control it. We have to subside it. We have to have a solution for it. So now, before getting into the another topic, again, ask to the participants, write down what are the causes that you have seen why people is having antibiotic resistance. Ask the participants. Give 2 or 3 minutes again, and then once they finish with the timing, then you have to explain. Ask why the main cause, what are the main causes of the antibiotic resistance. All the and causes has been already written here, so I have highlighted these three. I will speak about it later on. Firstly, we have to focus on these four. Firstly, what is the main cause of antibiotic resistance? Once is overuse of broad spectrum drugs without culture and sensitivity. If a person is comes to your hospital, as I said, whenever person arrive, immediately take the culture. Or if you want to start the antibiotic, firstly you have to check the culture. Why it is important? Because if you know the person is having resistance to xyz antibiotic, you will not start it, you will not use it, right? In that way you can control the antibiotic resistance. Similarly, there are second cause, overuse of the antibiotic without consulting with the doctors. Patients are having antibiotic like first generation, second generation, they are taking by their own. This is also one of the major leading cause. And the misuse, like suppose if I am your patient, and if and you have written please take the antibiotic for 5 days, and if I'm feeling okay, now I'm feeling well, I don't require further antibiotics, I stop the antibiotic. Now patient develop antibiotic resistance, because antibiotic has a time period that we have to complete it. Clear with that? Now, overuse of antibiotics, poor infection prevention protocols, these are some main causes that leads to the antibiotic resistance. The highlighted one, it's not in your control, but for your information, you should aware about it. Or if you feel that you want to add, if you want to explain to the participant, you can explain, but don't emphasize it. It's not necessary because it's not control of the nurses. Like antibiotic in agriculture and the food industry. Do you think you can control it? But it's the one of the cause, antibiotic resistance. Global spread of resistance bacteria through travel and the immigration. Do you think you can control it? But it could be the reason of the antibiotic resistance. The last one, lack of few antibiotic being developed. That is the national level strategies, right? So just check it. So these three don't emphasize, but upper four causes you have to emphasize. Clear with that? Now causes has been completed. So now ask, okay, do you think what are the impact that caused by the antibiotic resistance? Is it only impact the patient, or it will also impact to the healthcare professional as well? Take 1 or 2 answers from the participant, then you can explain to them. Okay, it impacts to patient, it also impact to healthcare professional, and it is impact to the community as well. Why? If patient is coming in your hospital with a mild illness and you have started the first generation drug, clear? Not first generation, you have started the high drug, the third generation drug directly, and patient who had a only mild illness. Do you think that if patient is getting resistance to that drug, and do you have other option for it? So it will increase the severity of infection. Patient will get longer time for recovery, because in the market then you don't have other alternative. And in the previous course we have already spoken about it. See, we have already spoken about it, lack of antibiotic being developed. So please make sure about it. Now, in healthcare professional, how they will impact it, then it will be difficult for them to choose the antibiotic. If you have already started third generation antibiotic and now the patient is getting resistance to it, do you think that patient will get treated with this antibiotic again? Because you don't have option for it. Clear? And need for more advanced drugs, it's similar to that one only. And is for treatment failure. Obviously, but if you don't have option, the chance of the failure of the treatment will be increased. Now how the community will affect, you can ask to the participants, right? Spread of resistance bacteria, the community will be resistant to the bacteria, it will not work, right? Similar, limited treatment option, then if we don't have an option, we have to even we have to move from this country to other country, because in this country we are resistant to the bacteria now. So please think wisely. That's why we are emphasizing on UTI. That's why we are emphasizing on the antibiotic resistance. It is very, very important. It's not a simple topic. You have to emphasize the concern of this topic, right? To the participants. Still, जब तक वो last में पहुंचे, तब तक उनके दिमाग में छप जाना चाहिए कि yes, it is very important. We have to start it. We have to start it. Clear with that? Now we have a case study. So before the case study, we'll see the sign and symptoms. Then only it will help you to handle the case study. Okay. Ask the participant once again. Okay. If patient is having antibiotic resistance, what common symptoms have you seen or have you observed? Ask, give 2-3 minutes and ask them. Okay. Write down in your notebook and cross check. Now I will explain it. So now for this impact, we have a footnotes. Please read the footnotes as well. So now what is the role so that your patient will not get any antibiotic? So firstly, ensure rational use, that we have already spoken about it. Educate the patient as well as family member so that the patient will not get resistance to the patient. If I'll give you example, if you will educate the patient, please complete the course of the antibiotic. Explain to the family member as well. Clear? So in that way, you can educate the patient, you can control the resistance. Monitoring and reporting. If patient is in your hospital, please your monitoring and reporting should be robust. Follow all the aseptic protocols. All the aseptic protocols means that one protocol to till last protocol you have to follow. Your patient should not get an infection. Now, the last one is the prevention of the UTI. If patient is having prevention, if patient is having UTI, so what are the things that you have to do? Hydration, antibiotic. If I'll go to previous slide, it's already written here. You can emphasize here. These are the treatment after UTI. Okay. Now, ask the participants. Now, again, we have a case study. So, again, you have to divide the participants into the group and ask the participants, please take 2 minutes and you just pause it and read the case study. Again, even though I would prefer you can do the role play as well. I'll tell you how. Okay. Give 2 minutes to participants and ask the participant, please write down in your group what is the common cause. Questionnaire I have already written in the footnotes. You can take the references. Firstly, read it. And now the instructor will read it. Now ask the questionnaires to the participants. So questionnaire I have already written in the footnotes. You can take the help. For you, I can repeat it. First question you can ask to the participants. First, what additional symptoms can be asked about when a patient present with burning urination? So this case study, like I'll read it for you once again. Imagine a young woman comes to the OPD with a burning urination, okay, and the doctor prescribe antibiotic, okay. Now after 3 days she is not better. The culture report shows that the bacteria is resistant to the common drug. Now we need stronger and more expensive and more toxic antibiotic, right? This is the reality of antibiotic resistance in UTIs world or to UTIs today. Clear? This is case studies belongs to antibiotic resistance. Now you have to ask certain question to the participants. The first question will be, what additional symptoms can be asked about when a patient present with burning urination? Agar burning urination, it's written na, here, burning urination. Now you can ask multiple sign and symptoms to the patient. Do you have any other sign and symptoms? Like ask about, do you have fever? Do you have a lower back pain? Do you have urgency? Do you have a frequency of the urine? Do you have a blood in the urine? Do you have any back pain? To check if the infection is more serious or has spread. As I said, it's started from urethra, bladder, ureter, and kidney. So with the sign and symptom, you can emphasize it is upper or lower. Upper UTI is more complicated. So with the help of the sign and symptoms, you can assess the condition. Clear with that? Next question you can ask to the participant, what risk factor in the patient's history can predispose her to a urinary tract infection? क्या बता रहा है हिस्ट्री? You have to check कौन कौन से risk factor it's speaking about, right? Like risk factor includes recent sexual activity. Ask Poor hygiene, ask the question. These all are history related question asked to the past patient. A history of the UTI, diabetes, are you diabetic? Use of urinary catheter, do you have a catheter, or are you frequently using catheter, or are you admitted before to the hospital, or holding urine for long period, are you holding the urine for long periods? These all are risk factor that you have to ask while you are taking the history from the patient. Next question you can ask, why it is important to send a urine culture before starting antibiotic in suspected UTI cases? So urine culture helps find the exact bacteria